Okay, so we're going to talk about the scapula today. So if you take a disarticulated scapula and you're not sure which side it goes on, you can come up here to the skeleton and hold the scapula up here. So this is going to be the dorsal side. You're going to be able to see the spine, and you're going to see what I call the handles out here to the outside. The way that you know this is not the other side or the wrong side is if you flip this over, this side is the subscapular fossa and it's on the ventral or anterior side. So if you just hold this up here, you'll be able to help you know that it doesn't go like that. Alright, so we're going to go through all these parts. So on your list, you have the first part, which is superior angle. Superior angle is going to be right here at the top. Inferior angle is going to be at the bottom. Then you're going to have the next parts, which is axillary margin, vertebral margin. We're going to go back to the skeleton, and I'm going to show you that if you look at this right here is the margin closest to the vertebrae. So this is the vertebral margin, and I tell students it's more straight up and down a little bit, slightly. This is the axillary margin, which is near your armpit, which is the anatomical term axillary, and it kind of goes out more at an angle. I tell my students toward their stinky armpits. So that's the axillary margin, and that's the vertebral margin, and this is the superior angle and the inferior angle. So therefore this is the superior margin and the inferior margin. Alright, let's go back to your list. If you look here on the next structure, it says scapular notch. If you look at the top, there's a notch right here, and that's the scapular notch. And then if you look here, here's the spine. And then I call the acromion the big handle. It's right here. I can hold it with my hand. It's this whole area right here. That's the acromion. Then you have the coracoid process, which I call the little handle, which is right here. So I can't really hold that with my whole hand. That's the process that sticks out right here. So that's the coracoid process. Not to be confused with coronoid process. So this is coracoid, and I tell them it's got some corduroy on it. You can pretend that. Then you have this part right here, which looks like it has an X on it. This is the glenoid cavity right here. Glenoid cavity, this whole part right here. If you look at it this way, it looks a little different, but it's this whole section right here. Then you have the next part, which we're going to flip it over. This is the subscapular fossa on the underside. If you run your hand across it, you can tell it's a fossa, and it's on the bottom side. So it's like subflooring, it's underneath. And you flip this back over, we have two more structures. We have the spine here, so supraspinous fossa is going to be above, and it's a depression right here, supraspinous fossa. And the fossa below the spine right here is going to be the infraspinous fossa. And that's all the parts you have to know.